name is Catherine Ranton, and I am from the University of Houston, Clear Lake. I will be discussing the prevalence of intellectual disabilities in children served by the child welfare system. We know that between 1 to 7% of children receive a diagnosis of an intellectual disability. We also know that the majority of children in out-of-home, non-familial foster care placements have been exposed to repeated, chronic, and complex trauma due to inadequate caregiving. Numerous studies exist that examine the chronic medical conditions as well as mental health needs of children in foster care, but very few have examined the experiences of children with intellectual disabilities within that same system. And very few even have studied their unique needs and strengths. Children with disabilities have been reported to have higher rates of placement into restrictive or institutional settings and have been exposed to greater placement instability, going from a familial caregiver to a non-familial caregiver and presence in the foster care system. This study uses an extant clinical data set from the University of Tennessee Center for Excellence for Children in State Custody, and archival descriptive analyses were run regarding demographics, disability type, mental health diagnoses, and placement type. The participants were children and adolescents ranging from ages 1 to 17, and each of them received an individualized cognitive, academic, adaptive behavior, and social emotional functioning assessments. What we see here is that most of the children fell between that 11 to 17 year age range, with the median age of children coming in being approximately 12 and a half, and many of them already having a previous diagnosis of intellectual disability. Those seen for the first time by the Center of Excellence and receiving a diagnosis of intellectual disability were about a median age of 9 and a half. We see that among these children, regardless of whether they received a diagnosis of intellectual disability or not, they were also diagnosed with a comorbid mental health diagnosis, such as adjustment disorder, anxiety, ADHD, autism, behavior disorders, mood disorders, or PTSD. We see that more often males were diagnosed with an intellectual disability than females. And we also see here that the type of placement varied on those with a diagnosis of intellectual disability and those without. So those majority, as you can see here, 85% of those with a diagnosis of intellectual disability came from a home that they had been exposed to either emotional or physical neglect. We also see that the variations between ethnicities, between African Americans and white individuals diagnosed with intellectual disability and those without, were varying across ethnicities. And the most interesting finding we found was that there was a significant association between gender and reported abuse type. So when we ran a chi-square, we saw that the results actually indicated that males experienced higher rates of sexual abuse than females. And females overall experienced higher rates in physical and combination abuse than males. And so we saw this small positive effect size that hasn't quite been demonstrated in other studies, which is one of the current strengths of this research, is that we had a large sample size of a vulnerable population, and we identified a unique relationship between gender and identified abuse type. And we can use this research to continue to evaluate the impact potentially of the welfare system on those with intellectual disabilities, as well as the impact on their academic functioning. And we can also use this research to study interventions that are really targeted for children with intellectual disabilities that also are present within the child welfare system and being served by non-familial caregivers.